Pregnancy after menopause. What you need to know about IVF, the decline of fertility with age, is a natural process, culminating in menopause, the end of menstruation. While natural conception is impossible post-menopause, advancements in reproductive technology, specifically in vitro fertilization, IVF, offer a pathway to pregnancy. However, this route comes with unique considerations and risks. The biological reality of menopause and fertility. Menopause is defined as 12 consecutive months without a period, typically occurring between ages 45 and 55. But fertility declines long before this point. Women are born with a finite number of eggs, and their quality and quantity decrease over time. By the late 30s, conception becomes noticeably harder, and by the mid-40s, natural pregnancy is increasingly unlikely. This is why the trend of delayed motherhood is significant. More women are facing fertility challenges simply due to age. Why this matters? Delayed childbearing is a modern phenomenon driven by education, career aspirations, and financial stability. While these choices are valid, they come with biological trade-offs. The number of women giving birth in their late 30s and 40s has risen sharply in recent decades, but so have the associated risks. IVF as a post-menopausal option. IVF involves fertilizing an egg with sperm in a laboratory, and then transferring the resulting embryo into the uterus. For post-menopausal women, this usually requires donor eggs, as their own eggs are unlikely to be viable. The process also necessitates hormone therapy to prepare the uterine lining for implantation. Success rates vary. IVF success in women over 40 is significantly lower than in younger individuals. Live birth rates are around 28% for those over 40, though some women in their 60s have successfully carried pregnancies using donor eggs. Despite these possibilities, IVF is the only assisted reproductive technology that can enable pregnancy after menopause. Other options include adoption or surrogacy. Health risks of later life pregnancy. Pregnancy after menopause carries elevated risks for both the mother and the fetus. These include miscarriage and stillbirth. The likelihood increases with age. Genetic abnormalities. The risk of chromosomal disorders, like Down syndrome, rises. Pregnancy complications. Gestational hypertension, diabetes, and preeclampsia are more common. Fetal growth restriction. The baby may not grow at a healthy rate. Premature delivery. Labor may start too early. Why these risks exist? As women age, their bodies are less efficient at supporting pregnancy. Underlying health conditions, like diabetes and high blood pressure, also become more prevalent, compounding the challenges. The bottom line: pregnancy after menopause is possible via IVF, but it is not without risks. Careful medical evaluation and realistic expectations are crucial. The decision to pursue IVF at this stage should be made in consultation with healthcare professionals, weighing the potential benefits against the increased chances of complications. Ultimately, while medical advancements are expanding reproductive possibilities, biology remains a fundamental factor.